Hi, I am Dr. Cosby, graduated from Mars University with a PhD in Ebola. Ebola, previously known as Ebola hemorrhagic fever, is a rare and deadly disease caused by infection with one of the Ebola virus species. The virus is spread through human-to-human transmission via direct contact with broken skin, blood, organs, or other body fluids of infected people, such as saliva, urine, and semen, and with surfaces and materials such as bed sheets and clothing. You can't get Ebola from air, water, or food unless it's contaminated. As the virus spreads through the body, it damages the immune system and organs. Ultimately, it causes levels of blood clotting cells to drop. Ebola was first discovered in 1976 near the Ebola River. So, if Saskatchewan River had an outbreak of some disease, it would be called Saskatchewan disease. Ebola River in what is now the Democratic Republic of Congo. Since then, outbreaks have appeared sporadically in Africa, most recent one being in 2014. Once the virus enters the body, it targets several types of immune cells that represent the first line of defense against invasion. It infects the dendritic cells, which normally display signals of infection on their surfaces to activate the T lymphocytes, the white cells that could destroy other infected cells. Other infected cells don't respond to infection, and neither do the antibiotics that depend on them for the white blood cells that could destroy other infected cells before the virus replicates further. With defective dendritic cells failing to give the right signal, the T cells don't respond to the infection, and neither do the antibiotics that depend on them to activation. The virus can start replicating immediately and very quickly. Some of the symptoms of Ebola are fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, unexplained hemorrhage, such as unexplained bleeding or bruising, bleeding from the mouth and rectum, such as butthole bleeding, bleeding from eyes, ears, and nose, and organ failure. So, as you can see right now, this disease is pretty deadly. Infection with Ebola virus can lead to flu-like symptoms, bleeding, both visible and internal, and in many cases, death. The current outbreak has a mortality rate around 60%. Steps of the symptoms are: first is exposure. Then comes incubation. Symptoms typically begin from 4 to 9 days after exposure. Through incubation may last for up to 21 days. The course of illnesses usually lasts between 6 to 10 days. In the first few days of illnesses, patients have flu-like symptoms and profound weakness. Around days 4 to 7, patients may also have vomiting, diarrhea, nausea, low blood pressures, headaches, and amnesia. towards the end of days 7 to 10, the illness, there is confusion and blooding, both internal and visible. All of this progress toward coma, shock, and death. The vital signs are abnormal. The blood pressure is low because the patient is losing blood internally and externally. The temperature of the patient is above average. Ebola disease is diagnosed by a blood sample, throat swab, or urine test. Scientists are still working hard to find a cure. Oh yeah, many years now and still working. So far they have vaccines available. Yeah, we've got that, but we've got no cure. Sorry guys. But on the good hand, we got some treatment for Ebola virus. Yeah, real good. Disease, however, there are many number of potential treatments currently being investigated. Yeah, it's been being investigated right now. So, supportive care involves the use of maintaining oxygen status, maintaining blood pressure, treatment of complicating infections, treatment of specific symptoms as they appear, fluid and electrolyte replacement balance. Yeah. To summarize everything, this virus is very deadly, serious, and has no cure, as I already mentioned. The symptoms come really late. So when you find out you have Ebola, you have a few days of living and you're gonna die. And are often confused with the other viruses. You're gonna think it's the flu by the time you're dead. There are only potential treatments available. The mortality rate of Ebola is 50%. Depending on a lot of factors, geography, how early the patient was diagnosed, and what the type of medication was given. To treat someone with Ebola, there are tons of precautions taken. Tell me about it. You have to tape like every part of our bodies, like over here I've got tape. It's just too much. Sometimes it just gets really hard for me and my wife. Doctors wear hazard suits and to isolate them. So, well, you saw my hazard mask. It's really expensive. So, to isolate the patient to prevent the virus spreading. That's pretty obvious. To protect yourself with the virus. Yeah. So, to protect yourself, it's pretty simple. Don't come in contact with anyone who's been infected. Don't. Stay away if you are aware they have the virus. Get away from it. So, I'll give you a few tips. If you have a boyfriend or girlfriend whose butthole is bleeding, just run away. Like, I'm trying to be serious, but just run away. Right there. Okay? It might be sad that you're leaving. So, if they're crying, it's like, also the blood comes out from the nose, ears, eyes, and mouth. So, like, if you, like, dumped your boyfriend from their butthole bleeding, and if they're crying blood, it's probably because they have Ebola. So if you need any more help, call me. I am the professor, doctor. I'm here to help, guys. Bye-bye. Oh, I almost forgot something. Wherever you live, well, you live. And if oh, I almost forgot one thing. Well, wherever you live. If you have Wi-Fi, key thing for this, Check out, please, for more information. Give you 5 more seconds to read it. Yeah! Well, see you next time for my next career.